Bismillahirrahmanirrahim. The model demonstration of kidney, the gross anatomy, then the magnified structure of the renal corpuscle, collecting tubule, etc., etc. And of course, in last, we will discuss the histology of the renal corpuscle. So, first of all, let's start with the gross anatomy of the kidney. Okay, so this is the magnified structure of the gross kidney. This is the medial border of the kidney, the medial border, and this is the lateral border of the kidney. This is the inferior pole, this is the superior pole of the kidney. And as we cut a transverse section, then we can identify structure like this. Inside we have the hilum of the kidney. This whole region is the hilum of the kidney. The hilum of the kidney, it receives the renal pelvis, arteries, vessels, lymphatics, sympathetic, parasympathetic nerves, etc., etc. So the the hilum of the kidney, first of all, it receives the largest structure, that is the renal pelvis. Actually, the renal pelvis is the enlargement of the ureter. This is the ureter, and as it enters the hilum of the kidney, it enlarges into a large tubular structure known as the renal pelvis. The renal pelvis, it branches off into major calyces. These are the major calyces, and the major calyces, they open up into minor calyces. These are the minor calyces. And the minor calyces are receiving the apex of the renal pyramids. This is the renal pyramid. First of all, I should tell you what's a pyramid. This is a renal pyramid. We have at least 11 or 12 renal pyramids in each kidney. So this is the renal pyramid. This is the base of the pyramid. And this is the apex of the pyramid. The apex of the pyramid is received by the minor calyx. Okay? This is another pyramid. Okay? Between the pyramids, you have got renal columns. And the renal columns are actually extensions of the cortex. Okay? Kidney is actually made up of two broad areas. The outer light area is known as cortex. This whole structure is known as cortex, outer light area, and the inner area, which have the pelvis and the pyramids, is known as the medulla. The inner dark brownish area is known as the medulla, outer area is the cortex, and the cortex, extensions of the cortex between the renal pyramids is known as a renal column. So two pyramids are having in between them a renal column. Yeah, this is very much easy to identify. These are two pyramids, and in between them, this is the renal column, which is the extension of the cortex. Okay? And then what's left? Okay, yeah. Pyramids are actually made up of collecting tubules. Okay? Collecting tubules, and renal columns are also having collecting tubules in them. Okay? I think that's, yeah. Actually, we have two types of nephrons in the kidney. We have cortical nephrons, and then we have corticomedullary nephrons. Okay? So in this model, we have these renal corpuscles. These are actually renal corpuscles, and since they're present in the cortex, so these renal corpuscles are representing the corpuscles of the cortical nephrons, and obviously the renal corpuscles of the corticomedullary nephrons will be present more inferiorly. Okay? Now the arterial supply of the kidney. पहले renal vein बता देता हूँ because it's easy. This is the renal vein. It actually corresponds to the arterial supply. So when we are studying the arterial supply, we are also correspondingly studying the venous supply of the kidney. So this is the renal artery, which enters the hilum of the kidney, and the renal artery, it branches off into 4 or 5 segmental arteries. So the renal artery, and dividing into segmental arteries. Segmental artery, 4 or 5 segmental arteries, and each segmental artery actually supplies 1 or 2 renal pyramids. And the segmental arteries are classified as anterior segmental artery. This is the anterior segmental artery, a superior segmental artery, anterior segmental artery, superior segmental artery, inferior segmental arteries as they represent inferior to the renal pelvis, inferior segmental arteries, these are inferior segmental arteries, and we have another segmental artery known as the posterior segmental artery, which is not present in this model. Obviously posterior segmental artery will be present on the posterior side of the renal pelvis. It is not present in this model. So we have superior segmental artery, anterior segmental artery, and inferior segmental arteries. And as the segmental arteries enter into the region of the medulla, and as they pass through the renal columns, they are known as interlobar arteries. When they are going through the renal column, they are known as interlobar arteries. And the interlobar arteries, as they reach the base of the pyramid, they arch, they diverge laterally and medially to form an arch, and these arches are known as the arcuate arteries. The arcuate arteries. Okay? And from the arcuate arteries, then we have these branches in the cortex known as the interlobular arteries. The interlobular arteries. I should repeat that the arteries correspond to the veins. So if we have interlobular artery over here, we will also have an interlobular vein over here. Okay, just parallel to the artery. These are interlobular arteries, and the interlobular arteries, they give off small radiating branches to the renal corpuscles. This is an interlobular artery, and these give off small radiating branches to the renal corpuscle. And these radiating branches divide into afferent and efferent arterioles. The afferent and the efferent arterioles, which eventually form the glomerulus of the capsule. This is the glomerulus. So it is formed by the afferent and the efferent arterioles. Okay, ji? Afferent and efferent arterioles. Yeah, this is the collecting tubule, the nephron. So I guess this is pretty much all about the gross structure of the kidney. Now we'll move on to a magnified structure. This magnified structure represents a renal column, a renal pyramid, a nephron, collecting tubule, afferent and efferent arterioles, interlobular artery, वगैरह. Okay? So this maroon structure, this whole maroonish structure is actually representing a renal pyramid, and this yellowish structure is of course representing the renal column. Okay, so now we'll study the main functional unit of the kidney. The main functional unit of the kidney is nephron. So nephron, it is made up of this renal corpuscle. Renal corpuscle consists of a Bowman's capsule. This is the Bowman's capsule, and the Bowman's capsule has inside it a glomerular capillary network. The glomerular capillary network, which is made up of efferent arteriole and afferent arteriole. The efferent and afferent arteriole diverge to form the interlobular artery. As I mentioned earlier, in the interlobular artery, it goes into the arcuate artery. In the arcuate artery, it further goes on into the interlobular artery between the renal pyramids. See, the interlobular artery. Interlobar artery. Interlobar artery, arcuate artery, interlobular artery, afferent and efferent artery, which forms a glomerular capillary network. Okay? So this is the Bowman's capsule, and from here we have the proximal convoluted tubule. The proximal convoluted tubule, and as it moves down, it forms a proximal straight tubule. The proximal straight tubule. Moving down, we have this thin segment of the descending limb of loop of Henle. The thin segment of the descending limb of the loop of Henle. This is the thin segment of the ascending limb of the loop of Henle. The thin segment of the ascending limb of the loop of Henle. This is the thick segment of the ascending limb of loop of Henle. The thick segment of the ascending limb of loop of Henle. And the thick segment of ascending limb of loop of Henle, it represents a distal straight tubule. This is the distal straight tubule, and distal straight tubule, it continues This is the thick ascending limb of loop of Henle, also known as the uh, distal straight tubule. And distal straight tubule, it continues into the distal convoluted tubule. Okay, this dark greenish structure is the distal convoluted tubule, and of course the distal convoluted tubule then continues forward into the collecting tubule. So this is the collecting tubule, and these are the further branches from other nephrons. Okay. So by the looks of this, it looks more like a corticomedullary nephron, because this is the cortex, this is the medulla, and this nephron is present at the junction of the cortex and the medulla. So this probably is the corticomedullary nephron. Okay. Now we move to another representation of the nephron, and here we actually see the arterial supply of the nephron, which is actually very important, because the arterial supply of the nephron is involved in secretion and reabsorption, tubular secretion and tubular reabsorption. So this is again a glomerular capsule. See, we have it right here, and we also have another one right here, but here we have the arterial supply, and the arterial supply of the nephron is actually known as the peritubular capillary network. As you can see, this capillary network, this is known as the peritubular capillary network. See, the peritubular capillary network. And since this nephron is most probably a corticomedullary nephron, so the peritubular capillary network, it actually gives off straight branches, and these straight branches are known as vasa recta. The vasa recta. सही है, ये peritubular capillary network है, and it's giving us straight branches known as the vasa recta, this parallel to the tubule. सही. And of course the arteries, this correspond to the veins. So this was pretty much the magnified structure of renal pelvis, renal column, renal pyramid, and of course the functional unit of the kidney, the cortical nephron. Now this is the histology of the renal corpuscle. We are not concerned with histology right now, लेकिन हमारा दिल का जोर बहुत ज़्यादा है, so we will also study the histology of the renal corpuscle. So it is made up of incoming artery known as the efferent artery, the incoming artery known as the efferent artery, and the leaving artery is known as the efferent artery. And the efferent and the efferent artery, they enter the renal corpuscle at the vascular pole. This entrance point of the renal and of the efferent and afferent artery is known as the vascular pole. And as it enters, it gives off, it divides into a profuse capillary network known as the glomerulus. Say glomerulus. This is the renal corpuscle. The renal corpuscle has an inner visceral layer covering in an outer parietal layer. The inner visceral layer is made up of special cells known as podocytes. These are podocytes having basal nuclei, podocytes, and the connective tissue of the renal corpuscle is known as mesengium. The connective tissue of the renal corpuscle is known as mesengium, and it is made up of star-shaped cells known as mesengial cells. These cells are star-shaped cells known as mesengial cells. A very specialized structure here, it is present in the afferent artery known as the juxtamedullary cells, and just on top of it, here as you can see, distal coronary tubule. So okay, so previous video continued. This is the distal coronary tubule, and a distal coronary tubule is having specialized set of columnar cells known as the macula densa. So these cells and these cells, they form a very special structure known as the juxtamedullary apparatus. The juxtamedullary apparatus. Of course, this is the urinary pole. The urinary pole continues into the tubular lumen, and this is the continuation of the proximal convoluted tubule, and the proximal convoluted tubule is made up of specialized cells having a brush border. This is the brush border of the cells of the proximal convoluted tubule, and this brush border is actually concerned with absorption, maximum absorption, at least 75% absorption of sodium, chloride crystals, water, glucose, etc., etc. Okay. So this was all about the model of the kidney. Thank you so much.
Bismillahirrahmanirrahim. Today we'll be presenting the kidney, the basic structure of the Bismillahirrahmanirrahim. Today we'll be presenting the kidneys. We'll be having the basic structure of the kidney, external feature of the kidney, arterial supply, and the internal structure of all. So first of all, come to the kidney. Kidney are attached on the posterior abdominal wall by the respective coverings, the exterior coverings. These kidneys are attached on the posterior abdominal wall on the respective side behind the peritoneum. So these are the retroperitoneal organs. Okay, so first of all we will be doing the external features. The external feature, the kidney is covered by the 4 coverings. We'll be discussing these covering from the innermost to the exteriormost. So the innermost covering is the fibrous capsule. Fibrous capsule is a kind of connective tissue. Fibrous capsule is a kind of the connective tissue. Okay, and this covers the inner layer of the kidney. From the fibrous capsule is the perirenal fat. Perirenal fat covers the kidney above the fibrous capsule. From out of the perirenal fat is the renal fascia. The renal fascia covers the kidney, and also above the kidney is the suprarenal gland, which is covered by the renal fascia. Above the renal fascia is the pararenal fat, which covers all of the structure. So these coverings connects the kidney to the posterior abdominal. Now come to the kidney surfaces. There are 2 borders of the kidney. One is the medial border and other is the lateral border. The medial border is divided into 2 by this hilum of the kidney. This is superior medial border and this is inferior medial border, and this is the lateral medial border. There are 2 poles of the kidneys, which is one is superior pole and another is the inferior pole. Now come to the internal features. We have the hilum of the kidney here, and the hilum of the kidney actually contains the substance of the kidney. The substance of the kidney contains the veins, arteries, and the ureter. We have the order of these structures from front to backward. From front to backward, these are, first of all, we have vein. After that, we have 2 branches of the renal artery. After that, we have ureter, and in the last, we have the 3rd branch of the renal artery. Actually, in this model, these are not shown as it is in the kidney. So these are the renal substances. After that, we'll be having the ureter. The ureter, when comes into the hilum, so this expanded part of the ureter is called the renal pelvis. The renal pelvis of this, which is ureter, actually divides into 2 or 3 major calyces. These are actually the major calyces. It is covered by the outer covering of the renal pelvis. So this is not here shown as clearly. The major calyces further divides into 2 or 3 minor calyces, which are connected to the medullary pyramids. These are the medullary pyramids, and we have about 1 dozen of the medullary pyramids in the medulla. So after that, the medullary pyramids, we have the cortex of the kidney. So now come to the cortex. And the cortex contains actually the glomeruli, proximal convoluted tubules, and the lateral convoluted tubules in the cortex. We may also have the Henle's loop, ascending and descending, in the cortex. But the majority of the Henle's loop and ascending and descending loops are contained in the medulla, medullary pyramids. These medullary pyramids are connected into the minor calyces. The projections of the medullary cortex, which comes in between the medullary pyramids, are called the renal columns. We have 2 basic structures in the medullary pyramids. One is the base of the pyramid, and another is the apex of the pyramid. The apex is connected into the minor calyces, and the base of the pyramid is connected to the renal cortex. Okay. Now come to the arterial supply of the kidney. The kidney is basically supplied by the renal artery. Each kidney is supplied by one renal artery. The renal artery is continuation of the aorta, and this comes from the aorta at the level of the sacral lumbar vertebra. When the artery comes into the hilum of the kidney, it supplies about 5 segmental branches. 5 segmental branches, basically we have the 4 major branches and 1 minor branch. The 4 basic branches and major branches are: 1, the superior segmental branch, which is not shown here, and the other is inferior segmental branch. These are two superior and inferior segmental branches. The other two are one anterior segmental branch, and the other behind this is the posterior segmental branch. The anterior and posterior segmental branches are further divided into superior anterior segmental branch and inferior anterior segmental branches. And the posterior branch is also divided like that. When these arterial segmental branches comes into the about the location of the minor calyces, these are divided into lobar branches, lobar arteries. When these lobar artery comes in between the medullary pyramids, so these are called now the interlobar branches. And this interlobar artery actually arcuate above the medullary pyramids and forms an arc. And this is connected actually anastomosed with the respective beside another branch of the medullary pyramid, interlobar branch. When this interlobar branch arcuates, so this is called arcuate artery. The arcuate artery further gives off the branches into the renal cortex, and these are called the interlobular branches. Okay. So
interlobar are present in the
interlobar are present actually in between the medullary pyramids. Arcuate arteries are above the medulla, and the interlobular branches are present in the renal cortex.
Okay.
So the renal cortex are actually anastomosed in between these arteries.
The venous supply is the same,
and the venous supply is actually the same, just as the arterial supply.
Simply come to this diagram.
Now simply come to this diagram. Actually, this is the nephron. We have the basic structure of nephron here, but it is divided into the medulla and the cortex. Actually, as I mentioned before, the glomeruli, proximal convoluted tubule, and the distal convoluted tubule are actually contained in the cortex, and another is medulla. The medulla basically contains the Henle's loop, which is a descending and ascending loop, and the collecting tubule,
which leads to the
collecting tubule actually leads into the minor calyces here in the kidney. All the collecting tubules leads here, which are shown here at the apex.
Now come to this one.
Actually, this diagram is of that of the glomeruli. In glomeruli, we have this arterial supply. When the arteries comes into the Bowman's capsule, in the Bowman's capsule, this forms the capillary network. In the capillary network, we have here the glomerular filtration, and this capillary network is bounded by the lumen of the Bowman's capsule. And this lumen actually continues here as a proximal convoluted tubule. So here in the lumen, the absorption of the minerals and the water here take place from the glomeruli. And in this lumen, it is actually called the glomerular filtrate.
Bismillahirrahmanirrahim. Okay, so the model of the liver. So it's the model of the liver, and we'll be discussing it right now. First of all, let's start with the ligaments. This is the falciform ligament. The falciform ligament, as it continues upwards, it divides into the left triangular ligament. This white line is representing the left triangular ligament, and on the right side, the falciform ligament divides into the coronary ligament. And as it continues upwards, it continues into the right triangular ligament. So the falciform ligament dividing into left triangular ligament, then the coronary ligament, and here we have the right triangular ligament. Okay. This is the left lobe of the liver, This is the right lobe of the liver. So this is the superior surface, and now we are going to move downwards on the inferior surface. So on the inferior surface, we have got a very complicated structure. This is a vestigial structure. I think this is the fibrous appendix of the liver. The fibrous appendix of the liver. This whole structure is representing the porta hepatis. Porta hepatis, the entrance point of many vessels, lymphatics, nerves, as well as arteries into the parenchyma of the liver. So yeah, this is the portal vein, the hepatic portal vein. This is the hepatic portal artery. Hepatic portal artery. Okay. This is the ligamentum teres, the fissure for the ligamentum teres, and this is the ligamentum venosum, the ligamentum venosum. ठीक है. This is the caudate lobe of the liver, a small structure on the right side of the inferior vena cava. This is the caudate lobe of the liver, and this is the quadrate lobe of the liver. This is the caudate lobe. This is the quadrate lobe. The gall bladder. This is the gall bladder. Okay, and this impression, this curve is formed by the esophagus, and this is representing the esophageal impression. This curve is formed by the esophagus on the right side of the inferior vena cava. Right side of the inferior vena cava. Esophageal impression, and this region, this curve is representing the gastric impression formed by the stomach. Gastric impression. This large impression is formed by the right colic flexure. This is the colic impression. Okay? And this impression is formed by the kidney, called the renal impression. And on the right side of the gallbladder, this small impression is formed by the suprarenal gland. The suprarenal gland. सही है? So this is the suprarenal impression. ठीक है? Okay. This large area is actually a very important area, because this is where there is no peritoneal covering. So this is actually the bare area of the liver. Bare area of the liver. And as you can see, this is the continuation of the right triangular ligament, and from here onwards this white line is representing the coronary ligament. This white line is representing the coronary ligament, and here then it comes in contact with the left triangular ligament, as you can see on the opposite side. See, this is the left triangular ligament, then it goes down, and then it continues into the coronary ligament, and now as it goes upwards, it forms the border of the bare area. It continues as the right triangular ligament, and outwards of the superior surface of the liver it forms the falciform ligament. ठीक है जी. The falciform ligament. Okay, coronary ligament हो गया फिर. हाँ, this is the inferior vena cava. The inferior vena cava, this huge vessel is the inferior vena cava. These are the right and left hepatic ducts. These greenish structures are the right and the left hepatic ducts. They join together to form the common hepatic duct, and the common hepatic duct then joins with the cystic duct. This is the cystic duct which is leading into the gallbladder. So the common hepatic duct, it joins with the cystic duct to give you the bile duct, the common bile duct. And this is the gallbladder. On top of the gallbladder you have the cystic artery, this reddish structure, the cystic artery, which is the branch of the right hepatic artery. And this is the neck of the gallbladder, this is the body, and this is the fundus of the gallbladder. ठीक है? this is where normally you have the suprarenal gland. So you can say this small area is representing the suprarenal impression. Okay जी. So this is pretty much all there is to know about the liver. We'll go through it if we've left any structure. Okay, one important thing. On the inferior surface, beneath the continuation of the falciform ligament, there is the round ligament of the liver. Okay, from the inferior surface of the falciform ligament, there continues a round ligament of the liver, which is not present here, but just for your information, round ligament of the liver.
इंटीरियर सरफेस हो गई, ये राइट सरफेस हो गई, ये सुपीरियर सरफेस हो गई, ये इसकी पोस्टीरियर सरफेस हो गई, ये इंफीरियर या वेस्टर्न सरफेस है, ठीक है। ये वाला बॉर्डर इंफीरियर बॉर्डर है। ये हमारे पास गॉल ब्लैडर का फंडस नज़र आ रहा है। ये हमारे पास फैल्सिफॉर्म लिगामेंट है जो कि राइट और लेफ्ट कोरोनरी लिगामेंट्स में डिवाइडेड है। अब ये जो हमारे पास लेफ्ट कोरोनरी लिगामेंट है वो फॉरन से इसी जगह पे इंटीरियरली तुम्हें डिवाइडेड हुआ नजर आएगा इनटू ट्रायंगुलर लिगामेंट्स, ठीक है। राइट लेफ्ट ट्रायंगुलर लिगामेंट, ठीक है। राइट जो है पीछे की तरफ नजर आएंगे। और ये सारा बेयर एरिया हो गया। कौन सा? ये वाला। अच्छा। ये वाला जो इसके दरमियान बेयर एरिया हो गया, ठीक है। अच्छा, और इसमें क्या है? अच्छा, पीछे आ जाओ तो हाँ, ये राइट लोग। अच्छा, अभी इस तरह से आ जाओ। ये तुम्हारे पास क्या हो गया? अच्छा हाँ, ये वाला लिगामेंटम टेरीज होता है, ये लिगामेंटम वेनोजम है, ठीक है। इसके दरमियान ये वाली कॉर्डेट लोब है, यहाँ हमारे पास कॉर्डेट लोब हो जाएगी, ठीक है। उसके बाद ये वाला जो है हमारे पास गैस्ट्रिक इम्प्रेशन है, यहाँ हमारे पास हो जाएगा नहीं हाँ कोलिक इम्प्रेशन है। और इस जगह पर हमारे पास रेनल इम्प्रेशन रेनल ही होता है। ये अभी मैं तुम्हें बता दूंगी, रुको। यहाँ हमारे पास जो है ना इसोफेगियल इम्प्रेशन होता है, ठीक है। इसोफेगियल इम्प्रेशन ये इंफीरियर वेना कैवा सारा हो गया। अच्छा, और एक चीज़ ये देखो, ये हमारे पास बॉडी हो जाएगी इसकी। ये सिस्टिक डक्ट हो गई। ये दो हमारे पास हेपेटिक डक्ट्स आ रही हैं जो कि मिलकर कॉमन हेपेटिक डक्ट बना रही है। सिस्टिक डक्ट इसके साथ मिलेगी तो ये कॉमन बाइल डक्ट बन जाएगी, ठीक है ना। उसके बाद अगर तुम इसके एंटीरियर टू पोस्टीरियर से इंटीरियर आओ तो तुम्हारे पास कौन सी आ जाती है? पहले हेपेटिक पोर्टल वेन, हेपेटिक आर्टरी और बाइल डक्ट आ जाएगी, ठीक है। टू द राइट थोड़ी आएगी। अच्छा, और इसमें क्या है? एक और इम्प्रेशन,
हेपेटिक डक्ट नहीं, मतलब कॉमन बाइल डक्ट
नहीं
फिर जो है ये है, ये तीन रिलेशन। कॉमन बाइल डक्ट है, पोर्टल वेन है और हेपेटिक आर्टरी है।
अच्छा, एक मिनट मुझे कुछ सोचना बस। इस जगह पर और क्या होता है? और ये क्या है? अच्छा, वो तो लिगामेंटम टेरीज हो गया, ये वेनोजम हो गया। ये इसके दरमियान कॉर्डेट लोब है, ये कॉर्डेट लोब है। ये हमारे पास पोर्टा हेपेटिस हो गया। बस हो गया पूरा।